So just as a reminder, this is for school and health department staff. We will post the slides and the recording on our publicly facing website. Just as a reminder too, to everyone on the call, all of the talks and all of the materials that we've shared with you over the time is also on our website. So if there's any materials that you're looking for or you're wondering recommendations, anything like that, they should be on our website, but always feel free to contact us if you have questions. Make sure any information that we share, if you feel like it needs to get down to your nurses, your secretaries, anybody else, pass that along. First thing, since our last talk, a new study was released by the CDC looking at just about 1,000 schools in the 2 largest counties in Arizona. Actually covered about 75% of the population of Arizona. Between the middle of July to the end of August, there were 191 school-associated outbreaks in those schools during that time. Just over 8% of them were in schools that had instituted universal masking early in the school year. About a third of them did have mask requirements, but they were instituted later into the school year, so they were not in place when the school year started. And just under 60% or 2/3 of them occurred in schools that did not have any masking requirement. So when they crunched the numbers, they found that the odds of a school-associated COVID outbreak in schools without a mask requirement were 3.5 times higher than in schools with an early mask requirement. Another thing you may have heard of, there was a student death related to COVID in Decanter, Michigan, which is down in southwest Michigan. It was a senior. According to the news articles, he became symptomatic and died a week later, was unvaccinated, did not, from what I could read, there was no mention of pre-existing health conditions, played football and wrestling, but there was no mention that he did or did not have pre-existing conditions, but just wanted to share that news. Another thing, I just got news of this article today, so I clicked through it in there. Just updates that rural areas have higher death rate or higher amounts of deaths from COVID than urban areas. And we see this with pretty much every health condition. Rural areas just have worse outcomes in health. But the top graph here shows the incidence of COVID-19. Could everybody just make sure that your phones and your computers are muted? I'm just getting some background noise. I'd appreciate it. Thanks. So the top graph just shows the incidence. The dashed line is the rural areas. The solid blue line is the urban areas. And then on the bottom, it's showing the difference in mortality rates, rural versus urban. And you can see that there's a slightly higher incidence of COVID in rural areas compared to urban, but the mortality rates definitely are higher in rural areas, more so than the case rates are. So in rural areas, you have a 1 in 434 chance of dying of COVID. In urban areas, it's 1 in 513. In terms of your local data, I'd refer you to the mystartmap.info website. I did check our hospitalization data. Again, we can't really easily find county by county pediatric data, but by regions, there's actually quite a big jump in pediatric hospitalizations in region 6.
Hey, Dr. Morse,
which is kind of this, yeah.
Some people are saying that they can't see your screen. I don't know if you want to try resharing it again.
All right.
I see it now.
Okay. Yeah, I have no idea. I mean, do the exact same thing, so I don't know. I have no idea why that happens. But anyway, so Region 6 is the central western part of the state, includes a good portion of our counties, but it also does include Kent County and Muskegon County, which is probably a good bulk of the population of that region. But there's been a pretty significant increase in hospitalizations. It's still, less than 10, but more. I think last week it was only 2 or 3 kiddos. So just to share that. Oops, I'm sorry. Still pulling up the data here for our school age kids, so 5 to 18 years of age in our area that have been reported with COVID. So this is week by week and compared to the comparable week last year. So this past week, we had 506 cases in our 19 counties that are involved on this phone call. The comparable week last year, there were 32. And so going county by county, I'll go somewhat slowly to show these, but again, we'll share these slides with you so you'll have that data. On the left is Aranac, and just as note, this isn't the best example because they do have the same y-axis here, but in following slides, the y-axis will change. Some have very low numbers, some have very high numbers. So just to note that there's different numbers there. But the left here is Aranac, and then Clare County, Gladwin County, and Isabella County, Osceola County, Roscommon County, Clinton County, Gratiot and Montcalm, Crawford, Kalkaska, Lake and Manistee, Mason and Mecosta, Missaukee and Newaygo, Oceana and Wexford. So again, we'll share these slides with you. We've had some schools that have had some closures, and overall throughout the state, there has been some leveling off. So we'll get into that now. Overall, all the counties in Michigan right now are at a high transmission level per the CDC classification. Our positivity rate statewide is at about 8.8%, so pretty steady. That has been decreasing a bit. However, the case rate still continues to increase slowly, and has since the low in June. The 10 to 19-year-olds are still the age group that are having the greatest increases in case rates. So over the last week, on average, every day, there's been 370 more kids under the age of 12 becoming infected. There's been some increases in outbreaks, and I'll go over the school-based outbreaks throughout the state later on. So these are the case rates in the state. And then this is per age, again, rate per that population of age. This blue line here that really spiking up is the 10 through 19 year age group. So that has, for several weeks now, has been the most rapid and largest age group. The black line here with the other arrow, that's the 0 to 9 age group. So they've had a little blip as well, but not as significant. These are the trends since the summer in positivity test rate in the top left, inpatient beds occupied by COVID patients on the top right, daily case rates on the bottom left, and then daily deaths on the bottom right. Just to illustrate that we still do have a pretty large burden of illness, especially in our hospitals, but hopefully things may be leveling off at this point. Hopefully. This is the hospitalization trends. Again, still some increase there. This is just an interesting illustration, just showing that the total hospital occupancy is about the same now as it was at the very highest it was in April. The bulk of it is made up of non-COVID patients, and we don't have as many COVID inpatients as we did in the spring, but this is traditionally a very busy time of the year for hospitals, so our hospitals are just very, very full right now. The pediatric data, the percentage of kids in the last week that have made up the total COVID cases is a little over a quarter, just a little bit higher than last week. There's a little bit higher percentage of kids that made up the total amount of individuals getting tested, and a little bit higher percentage of kids testing positive, but otherwise throughout the US it's been pretty stable. This is hospitalization rates on the left in those 0 to 17. It's a hospitalization rate in the US. On the right is the hospitalization rate in Michigan for those 0 to 17. So the US, most other states had their peak before Michigan, so those rates may be starting to go down, but in Michigan, we peaked a little bit later than the US as a whole. So, it's kind of hard to know when we're gonna finally peak and start coming back down again. So just a reminder that half of kids in Michigan that are hospitalized have no pre-existing health conditions, despite a lot of the argument that that's the only kids that are getting really sick. In terms of outbreaks, there was a 9% increase in total outbreaks in Michigan. 64% of the new outbreaks were related to childcare or K through 12 education. There were 1,200 total cases related to ongoing school outbreaks and 610 cases related to new outbreaks. And I graphed these out again, like last week's. I think it's just kind of hard to visualize all that otherwise. So I just added in this week's report on the left here. The green is the number of ongoing outbreaks in K through 12 schools. So those are ones that have had continued cases reported within the last 28 days, or within 28 days of an outbreak. So basically outbreaks that are still kind of smoldering. The yellow one is new outbreaks that have been reported. And then on the right are the number of cases related to both ongoing and new outbreaks. And then just an update on vaccine breakthrough cases. I know we get questions on this, and so just for your awareness, there's been 4.8 million people in Michigan that are fully vaccinated. Less than 1% of those individuals have gotten infected once they're fully vaccinated. This table gives the actual breakdown of that data. So 0.636% of those people in Michigan that are fully vaccinated have been diagnosed with COVID. 93.8% of cases in Michigan are in those that are not fully vaccinated. As more people get vaccinated, the percent of people diagnosed with COVID who are fully vaccinated seems to get bigger, but that's just statistics again. So it's less than 1% of people that are fully vaccinated get COVID. 0.025% end up in the hospital, and 0.009% have died that are fully vaccinated. So it's still, showing good efficacy. It's just, again, there is a certain percentage that do still have breakthrough cases, hospitalizations, or death. So I just wanted to share that because I know people always wonder about it. So that's the end of my slides. I will stop sharing here. And I'll go to questions. So the first one was, are Pfizer booster shots currently recommended and available to school employees? Yes, school employees were listed as one of those occupations that is at increased risk of COVID, and they are available. And so you would schedule through the health department or through a local pharmacy or wherever those vaccines are available. And then that was the only question in the chat box. If you have any questions, please feel free to put that in the chat or go ahead and unmute yourself if you're on mute. I did mute the lines earlier, and so you may have to push *6 on your phone if you're on the phone. So I will, in the same vein as booster shots, we are still seeing quite a few employees, not just in education, but other occupations who are getting COVID or have to quarantine because they are not vaccinated. So I would encourage you to continue to promote vaccination in your staff and your students and the community as a whole to try to prevent those situations. I did get a question, if we had Moderna for the original vaccination series, should we be considering the Pfizer for a booster for school employees? So at this time, Pfizer is the only vaccine series where there is a booster approved. So only those that received Pfizer for their original series would get a booster at this time. Moderna has submitted their data to the FDA for review, and so we should have recommendations of whether those who got Moderna need a booster, and if so, when, and all of that, hopefully soon. But right now, only if you got Moderna for your original series would the booster recommendations apply. Do there appear to be side effects with the booster shot? In the studies that they did and the data they presented, it appears comparable to the second dose, or less so. So typically it's not significant or not that bad. People may want to consider getting that, on a Friday or something, just to be sure that they don't miss work. But from the data that was presented, it does appear to be, no worse than the second dose, and if anything, less side effects. Another question is, any word on vaccine availability for ages 5 through 11? Pfizer did submit their application to the FDA. The word on the street is that the FDA is supposed to review that, and then their advisory committee is supposed to meet this month, and if everything goes well, we may have recommendations and approval by the end of the month. I checked today, and there is no meeting set up for the FDA Advisory Council yet to discuss it. So we don't have any idea really of a firm timeline, but hopefully by the end of this month or early next month, there will be approval, and we'll be moving forward with vaccination of that age group, but we don't have anything firm on that. And that would be with Pfizer, and so that would still be a 2-dose series, and so they would not be considered fully vaccinated until 2 weeks after their second dose. So just to give you an idea that, once it's approved, there'll still be a delay before that age group would be considered fully protected. Any other questions? Okay. Do you have statistics for vaccination status on 16 to 19 and 12 to 15? That varies very greatly for county. If you go to the michigan.gov/coronavirus, on that front page, there is a tab for vaccination statistics. And then I will make a note to myself next week. I will make sure and pull vaccination data for our areas and show those again. They're likely, I don't think we've had a lot of change since the last time I've presented that, but I will put that in the report next week. Any other questions? Thanks, Steve. Steve put a link in the chat box to the vaccine statistics. Yeah, and for answering for Penny, what I'll do next week, I'll make sure and include, I had those images where it had colors for zip codes to give you an idea, but I'll see if I can't even pull specific numbers for zip codes, because even within our counties, we have different zip codes that vary tremendously. So I will, I'll try and pull the best data I can for next Thursday. Any other questions? I did get a question today from a reporter about Halloween, and to be honest with you, I hadn't really even thought about Halloween yet, and not that it necessarily applies to you guys, but just for your awareness, there really is not any recommendation this year to cancel Halloween activities. We're just like with school, we're not as worried about objects being a source of spread, and things that are outside are not as high risk. So things like trick-or-treating are not considered too risky, as much as you can pass things out outside and keep groups small, and keep your hands washed, things like that are best. Large gatherings or things indoors are obviously a risk and are discouraged, but just if you personally, or if people are asking about trick-or-treating or things like that, that's the consensus right now. So I got a couple more questions. Getting doctor's notes for return to work with negative antigen tests. However, we have had a few false negatives. I know that's a bit tricky because you are supposed to take a doctor's word for it. If someone has symptoms and tests negative by an antigen test, ideally there should be a confirmatory PCR test. However, there has been some debate about that. If you go to the CDC's testing page, they do have a tool where you can put in the information about the individual's test results, their symptoms, their exposure, where they live, things like that. And it does give advice as to whether or not a confirmatory test should be considered. I mean, you can always have a policy as to whether or not you're going to require a confirmatory PCR test, but it is a bit challenging to go against the doctor note, especially when, the PA 339 says that you can go by a healthcare provider's instructions. So long story short, I think if a healthcare provider is giving clearance, you're safe to allow them to come back. But again, if you're uncomfortable with that, you can require a confirmatory test. I do know it is a bit tricky to find quick testing right now. Another question, should students with mild symptoms come back to school if they test negative and universal masking is in place? So with students, if they have symptoms and they test negative, or they have an alternate diagnosis or reason for their symptoms, like they get tested for strep and they're positive for strep and had a sore throat and a fever, yes, they can return to school. It is ideal with staff or students that if they did have symptoms, they tested negative for COVID, or again, were given another diagnosis, it is ideal if they would wear a mask for 10 days after symptom onset, just in case. That is a safe recommendation. Obviously, if that's going to be a very controversial or difficult issue with parents, it's not required. But yes, and there is an algorithm on materials that we sent out before school started and is also on our web pages, but it goes through what to do with staff and students who have symptoms and with test results and things like that. Any other questions? All right. Well, I did not clear this with my staff, but I'm sure, if you have enough teachers that are interested in boosters, talk with your local health department. We could potentially set up a vaccine clinic if that, if there's a large enough number where that is more time efficient for everyone. Otherwise, we're happy to schedule those or get those taken care of for you. Continue to encourage vaccination as much as possible so that we can continue to stop the disruptions to your education. So, all right, well, we'll get the slides and the recording sent out to you guys. And as always, if you ever need anything else, just give us a call. Have a great rest of your week.